So the next thing is like how to care for your teeth. I mean, if you don't mind, does everybody at least spend time every day caring for their child's teeth?
Yeah, try.
Yeah, try. And that's it, try. Totally try. Try is and that's, you know, gold stars. Although you're like, you have an effort there, it's on your list of things to do, that's key. The next thing is that there's nothing magical about the bathroom. I mean, there's nothing magical about the bathroom. Unless they are totally be able to spit out into the sink, and if you're using fluoride toothpaste, then I don't want them eating a ton of that necessarily, but we can talk about different, I don't want to get into details about fluoride, for everyone's a little different, but I can tell you some kind of tricks around. But really the most important thing is to at least wipe off the food, the debris from their teeth every day. So that does not have to be in the bathroom. It does not. Actually, when they're kind of contained, if you have you know, some issues with being able to control the toothbrush and they really need you to help them, it's kind of best when they're like in a kind of strapped in situation. So high chair, stroller, car seat, you know, those kind of things are the ideal time. So and then also one thing that there's some sensory issues a lot of times and taste issues. So I'd much rather you take a toothbrush or a washcloth that just has water on it and try to get in there. Is much more important than avoiding it because we're having a day. That is definitely a really important thing. The next thing is that, so to come from behind. So if you are, let me sit here. So even if you think about it, when you're at the dentist and you're laying, you know, the traditional way, laying back, we're behind you because I can control your head a lot easier. When you come at somebody like this, our natural defense is to you know, bob around. But if you can stabilize your child's head, that is very helpful. So I know when you're 7 and above and 14, it's harder. But when they're littler, or even maybe you're a 4-year-old, you sit them on your lap, and this is for all kids. I mean, even, you know, neurologically typical kids. If you lay the child here, and if you can stabilize them, if you come from behind like this, and you can stabilize their head, it's a lot easier.
You can also see that.
Yeah, you can see a lot.
That's worked a lot with Annabelle is coming.
Yeah, so positioning, if you can come from behind, if they're with you like on, you know, with a book or something like that, and you can distract them, anything that you know what can keep their way there, keep their attention, that is a great way to do this from behind. Another, if they're laying down, this is a 2-person job, but if they're laying down, say the child's head is here, the one person can be like this, keeping their hands down, talking to them, getting their focus. And then the operator, the person who's cleaning, will be from behind here and then clean. So that's like a 2-way if they're laying down. If you're changing them or something like that. So, and it's just, as you all know, I mean, just talking, telling them what you're doing, getting those comforts is key. Also, so I talked about methods to clean their teeth. Like I said, a toothbrush is fine. The vibrating toothbrush, a lot of times that stimulation is actually a good thing. So you have to balance the noise. So I mean, again, every child just kind of give you different tools, but if you can tweak it, but if you can, that vibration is actually stimulates and it's very good, especially on if your child also has the autism spectrum, that's very helpful. So you can go ahead and get a little battery operated one, but the Sonicare one I really like because it has a good grip. So they can, you know, I know depending on their muscle tone, if just trying to, you know, tweak everything, but if you can help them to teach them to do it, but it has a nice heavy grip on it, and the head is small. So yeah, so it has a kid Sonicare. So that is a product I don't have no connections with them, but you know, I mean, that's good. But if they're into some, you know, princess or Spider-Man, and that's going to motivate them, of course, that trumps anything else. But those kind of like spin brushes that you can buy at the market, they're a little big. So because they have a round head and a stationary head, and that's a lot of bulk to get in their mouth. So I would actually recommend the Sonicare has a mini head. If you buy it online, it comes with a standard head, but you can get like on Amazon the mini kids heads. If you buy it at a dental office, it's just they give you 2 size heads, but there is 2. So you want the mini kids head. Okay.
Annabelle uses the Sonicare, the little itty and it just cleans so much faster and
It's
so
more
much easier.
efficient, yeah.
And she actually really likes the buzzing and the vibration. But obviously every kid is going to be different. But we've seen a huge difference, and it's also helped when we go
Right,
see
so,
Jill.
yes.
It has sort of like
Because it's actually
desensitized her
that
to
noise,
having- Yeah.
the noise that connects with it. Okay, so that's one toothbrush. If you're gonna go with a manual toothbrush, always go with one that's smaller. So I know in a lot of the special needs markets, they have that one with 2 heads and they bite on it. It's really big. And then they end up biting it and then you can't have any motion with it.
Yeah.
So I'm actually not a fan of those. I'm not, but there's that banana one, they have different grips, love all that stuff, that's fine, but I don't love that double head. It's always better to go smaller, even in a 14-year-old's mouth, so if you can just get around anyone, I mean, gaggers, it's just always better smaller. Okay, so that's that part. Water is sufficient, not gonna help you from decay, but better than not doing anything, 100%. The next thing is, a xylitol fluoride-free toothpaste. So xylitol is a natural sugar alcohol that lowers the bacteria that causes decay. So it's in Trident gum, it's XY, xylitol. There are many fluoride-free toothpastes, only about, I'd say there's 1,000, but only 100 of them are good. What you want is you want that ingredient xylitol to be one of the top 3 ingredients. So baby Ganex, a lot of you are probably familiar with. Jason's, if you go into a Whole Foods or any kind of like a natural market in your town, they have the best selection typically. Jason's is a very clean, natural brand. Tom's is one that you're like, oh, I can pick this up at Target.
Could you come closer to the microphone so we can get that I'm sorry.
Oh, yeah, of course.
Why fluoride free?
Okay, so I'll explain that in 1 second. Do you want me to carry this over there? Okay. Let me just finish with the products and I'll explain exactly what that, why is that not. So, Jason's, Tom's of Maine is easy to find. It's in like a lot of places. However, it doesn't have as much of the xylitol in it. So if you can, Baby Ganex, Jack and Jill, Dr. Brown's, a bottle company, they have a product that's called Happy Teeth. That's also with the big Dr. Brown's. They also, those are just a few that have more of the xylitol. So depending on where you live, you may or may not have fluoride in your water. If you have fluoride in your water and your child is not spitting out, they will be ingesting what, I think of the toothpaste as food. So in Los Angeles, where I practice, the LA is fluoridated. So if I put a bunch of toothpaste on a child that isn't voiding, then they're eating it. So they're getting a dose of fluoride when they already have fluoride in their community, in the water they drink, the fruits and the vegetables, the pasta that you boil. So they are getting some fluoride. If they can void, I don't care. Doesn't make a difference what they do. But if they can't void, and they are older and have if they have all their teeth, I would rather err on a little bit of fluoride. A little bit of fluoride. But if you are in a community that has fluoride and they're not voiding, I rather, and your dentist says it's okay, I'd rather err on less fluoride. It's just something else that they're putting in their body. So those fluoride-free are cleaner. Fluoride reduces your risk of decay. That xylitol lowers the bacteria levels that cause decay. They're 2 different things. One puts armor on it and one kind of makes it a cleaner environment. Okay, so they're 2 different things. But if your child is not voiding and it's been recommended to use fluoride toothpaste, I would always just put a little amount. More is not better. Like just a little smear of it, not even like a dot on it. That it's like one's cavity, anti-cavity, and one that helps the bacteria. Yes.
Sorry, I don't know if you want us to ask
Yeah.
questions now. But
No, of course, anytime.
With
Please.
the xylitol, are there wipes, xylitol wipes?
Oh yes. Okay. So
Okay.
perfect. Okay. So we talked about toothbrush. We talked about toothbrush and water. Now I kind of briefly passed over it, but I'm happy. Another thing to do is if you can just get in there with your finger on the outside. Kids rarely will bite your finger unless you try to go on the chewing surfaces. So we can do a combination. You can take a washcloth, and they do make them with those impregnated with xylitol. Spiffies, one brand, teeth wipes, they're all kind of the same. But you just want to look up xylitol wipes, put it on your finger, and literally do this. Go around. This will help because the plaque sits the gum line. Then give your child a toothbrush, either electric or manual. And when they're gnawing, how they kind of just gnaw, that helps clear the food away from the chewing part. So they're doing two different things. So they're helping, but you're helping that gum line, like for the gingivitis, like for the inflation around the gums. It's really hard. I mean, it's really hard to get every kid. I mean, my 12-year-old still is the worst brusher. I mean, to get at the gum line. So if they don't have the muscle tone or things, and if they're difficult for you to get in there, if you can lift it with your fingers, it's always much better. It's always, yeah, so they do have wipes that have it. Or a cheaper way, honestly, is to put a little of the fluoride-free toothpaste on a washcloth and do that too. But again, these are all different textures. Another way, if their child, especially they're older, like if they're 14, they need to have that fluoride exposure, you can dip the toothbrush in a fluoride rinse. So now we don't have as strong of a flavor, and we don't have that like foaminess in there that may or may not bother your child. And if they're not voiding, but you want to have that exposure, they're not having all that buildup. So you dip the toothbrush or dip a washcloth and wipe it on their teeth. ACT is the major Johnson & Johnson brands. You know, your drugstore, CVS, Walgreens, it doesn't matter. It's all the same stuff. So you just want to dip it in there and wipe. So that's another helpful thing as well. Whenever they're chewing on, if they have chew toys and things, all of that salivary flow is actually a really good thing because your saliva does have natural things to help buffer decay. I don't know, remember back in the day they had the Trident where like you put two pieces and the salivary flow went up and it helped reduce the decay rate. It's just that same natural wiping away. So anything that promotes salivary flow is a good thing. If you're going to choose one time a day to take care of their teeth, the closer it is before they go to bed after that last food exposure is the best. If you only have, time to deal with it once a day, it's before they go to bed, because while they're sleeping, everything sits. So that's when the bacteria in their mouth go to town and cause decay. So the morning brush is a lot less important than the evening brush. So, yeah, because you just kind of sit. Grinding is very normal, very, very normal, especially if they still have a lot of their baby teeth in their mouth. It sounds like they're gonna break their teeth, like nails on a chalkboard. And it sounds horrible when they're sleeping. It's because everything's really dry. Remember I said everything sits. They're not, moving around. It all kind of sits. So it's like, they're really not gonna break their teeth. I mean, one patient a year of the thousands and thousands that I see. I see a broken baby tooth from grinding, but it really isn't common. It really isn't common. Yes. Does anyone have any questions at this point?
I have another one.
Yes, yeah.
You haven't tapped on it
Oh,
yet, but
okay.
I don't know if.
Yeah, go ahead. You can,
Okay,
yeah.
this might not be your field,
Mhm.
but our daughter is very good at brushing the opposite side only, and that's all she will ever do.
Okay, yes, okay.
So
So,
this
that-
doesn't work.
right.
So
So,
we need help with that.
yeah, so opposite, everybody's easier across body. Let me tell you, across it. I have, in all populations of kids, the handed side that they are is always dirtier. And maybe even for you, it is as well. So it has to do with the brain connections and stuff. So it's always easier to go across our body. So you're just going to have to help her get on the other side. I don't have any pointers for that. I can't redo the brain, that part is that. But I'll let you know that's normal. Okay, so I mean, that is a typical pattern for everybody to go across body. We see that constantly. I go a little bit on that line. If there's pain or discomfort, it usually doesn't cross the middle. So if you notice they're avoiding something, they may not be able to acknowledge top from bottom, but it rarely crosses the middle, just as far as like pain or discomfort. So that's just kind of a little side thing. So kitchen, in a high chair, however they eat, in a car seat in the car, if so. That's kind of how I tell you to do it at night. They're not going to go in the car, but if you can do that. If the only time is when they're strapped in the morning, or even if you feel comfortable to have them to even like chew on a rag in the car when you're like going around and doing things, like maybe if you just have breakfast, you can do that for them to do independently. That will also help. Okay, so a little amount of fluoride, a little dot. If they're not voiding, especially if they have more teeth, I would always check with the dentist, but fluoride-free dipping with the fluoride is also helpful as well. Coming from behind, putting their head back, 2 people on the floor or in a changing table, any kind of environment like that is helpful. So those are kind of, so let me see if there's anything else I wrote down. Oh, okay, so now, what causes decay? So I mentioned a little bit about bacteria, right? So this is something that usually shocks people. When people say, oh, like decay runs in my family, right? Like, I don't know how many of you have had a cavity or haven't had a cavity. 80% of the decay is only in 20% of the people. So kind of if you get decay, you get decay. Or you don't. I mean, I'm 45, never had a cavity. I am not the best brusher. I am not the best eater. I'm not the best flosser. My life's passion was not to be a dentist my whole life. I mean, no, I don't have that bacteria we're talking about. But you get it from transferring. So a primary caregiver that is not a blood relative can transfer the bacteria to your child. So how do you transfer it? Kissing on the lips, blowing on food when they were little, and it's like wiping something that fell on the floor that you give to them. The bacteria, if you are a cavity maker and you do that, you can transfer it to your child. It's strep mutans is the kind of the class of bacteria that cause decay. So your infections over that, you acquire it. So what I would just recommend doing in this, just to kind of make sure, I mean, you're not going to not love your child, you're not going to not blow on their food, but if you just have that knowledge, one thing that if there's somebody around that isn't, you guys, chewing on xylitol gum, Spry is a brand. Trident it'll say with xylitol on the package, but it doesn't have a lot of it. Spry gum is a lot higher quality. If you guys, SPRY. If you pop a piece in your mouth after you chew, it just helps lower that bacteria. These are just things that help. I'm not gonna guarantee it's full, it's gonna never get a cavity, but you actually acquire the bacteria. Your DNA and stuff gives you your facial appearance, or if you need braces and all that kind of stuff, that's genetic, but the bacteria is actually acquired. Yeah. So, yes,
Is that like forever? Or is
Okay,
there
so you
a
can
cutoff,
try to,
or-
when you can acquire it?
Yes.
Okay, it's the window of infectivity is what it's called. It's like 0 to like 3. Yeah, 0 to 3 typically.
Do they still have the xylitol suckers?
They have xylitol lollipops as well. Yes, they do. They do. Do I have any? Not with me. Yeah. Yes. So you need to make sure that says xylitol, because I know there's like a brand that says natural suckers and it's all sugar, but they're not anything artificial in it besides sugar. And that's a good lead into my next topic. Thank you. But there are ones that have xylitol. If you have a lot of xylitol, if you consume a lot of it, it just might give you loose stool because it's bacteriostatic, so it's going to clean out your whole GI tract. If like one way of a holistic kind of way to like help with GI issues is to give it like teaspoons of xylitol, and they kind of clear out and restart the flora. I'm not recommending that, but I'm just like giving you like another way. Yes.
Can you test if you have that bacteria?
Yes, some dentists have their swabs, and you can test. So you can ask the local dentist if they have it or not. From 0 to 3 years, typically, is when you acquire that bacteria, typically. Yeah, and you can help lower it with xylitol products. And also just making sure that you don't have a lot of decay hanging around in your mouth that you're aware of, because that just adds more fuel for the fire for the bacteria to multiply and do their things. But bacteria that causes decay and the bacteria that causes gum disease are 2 different families. Yeah, so they're like, so people can have, a lot of times they have, I'm kind of going on a tangent, but just for your information on your oral health, people that usually have like gum disease usually have like okay teeth. And if you have really bad teeth, a lot of times your gums are fine. It's kind of, at least then if you really got the short end of the stick, you have both problems, but yeah. Yes.
I have a question, but I'm not sure anybody in the room is going to be able to answer it very well. My daughter, Marina, is 20. And we've been hanging out in this group since the sport was a group.
Yeah.
And a lot of I can't say a lot. I have talked to some other parents with kids who are adults at this point, and they don't always get all their adult teeth. Marina didn't get all of her adult teeth. Her
Canines,
never. So what happened was the baby teeth stayed there until actually just last year, and then one fell out.
Yeah, I'll be more than happy to go over all that. So, first of all, a lot of, in my research, to prepare for this talk, with the Duke kids, is that the cleft palates. Does she have any clefting at all?
Not cleft, but high.
High palate, yes, high palate. So a lot of times with clefting, you have missing teeth in the cleft mark, so that would be. The high palate has a lot to do with then the positioning in the orthodontic issues. Congenitally missing teeth, like if you don't have adult ones to replace it, usually is a familial component. If somebody in the family didn't have all of their wisdom teeth, that's still a missing tooth. A lot of times people don't think about that, but maybe like, oh, I didn't have, some uncle, aunt had, only 3 of the 4, and or it just spontaneously happens. Now, if you talk to a lot of families and they have, others that don't have the adult replacements, the typical regimen is to keep the baby tooth in the mouth for as long as possible. Baby teeth fall out because adult teeth push them out. So if there's no successor, they typically stay in the mouth. And I have a lot of patients that in their 30s and 40s still have an adult molar, a back tooth, which is not the eye tooth. The eye tooth is kind of a small, thinner root, but the back molars are 2, and on top they're actually 3 rooted. The tooth that like how I do this, I'm very, do a lot of shows in the office. The replacement for a baby molar is the premolar, who's actually a smaller tooth and has less of a root structure. So the back molars, that's what you're missing, a premolar, typically will stay. But the canine, a lot of times you do end up losing that one. Yes?
Yeah, with our daughter,
Uh-huh.
her teeth just grew so there was no room for the canines.
Okay.
So we ended up having to take out.
So it got caught, oh, yeah.
And then the canines did.
And then on top, it's because the palate is V-shaped or very high, the circumference is smaller. So it's pure physics. If we all stand in a circle and we're like mushed together, that we can't fit anyone else in. But if we have, so we're like this. But if you were able to tolerate orthodontics and could expand the upper jaw,
We did that too.
and they still didn't work. Okay. Yeah. I mean, these are just, again, every scenario is different. But if you stretch out, more people can come in. So it's the same thing. So if you can increase the circumference, then it won't be as crowded. But congenitally missing teeth are a factor. The most common are the wisdom teeth that are missing. Then it's the side upper ones that are missing. And then it ends up being the second molars that are missing. So does she have adult eye teeth? Did she have adult cuspids?
I don't think so.
They're missing altogether. Yeah. So those are things that you're, again, it's individual basis, and then you work with a team, right? You're like another team of an orthodontist and a pediatric dentist together to figure out how we can make it be as functional as possible, just to avoid an artificial placement like an implant, because that, to hold space, those are just not really usually options. I definitely guide all my families to try to have as little fake in the mouth as possible. So I much rather selectively move teeth to have other ones grow in those spots, on an early intervention, so then you won't have to try to make space and hold things. So those are, whatever's there, if we can keep as long as we can, if we can guide things in, even by maybe a primary tooth extraction early to guide another tooth in the right spot that you have. And you can take the x-ray that tells you which teeth you have with the one that's called the Panorex. And that requires very little behavior on the cooperation on the child's part, because we can do it in a wheelchair. All they have to do is bite it right here. So you're not trying to put a film in their mouth, and it comes a little thing that kind of stabilizes. And a parent can kind of keep their body up and stay in there. Obviously, we'd have the parent wear a lead apron, but in it, what goes around your head. So of all the dental films in an environment when the child's awake, the Panorex is probably one of the easiest ones to get, and it gives you the whole forest. It gives you everything from their condyles and condyles. So the next thing I want to kind of go into is the dental visit. That is one of my goals, that I get all my kids with special needs to be able to take a Panorex. That's
What
something.
age should we go to the dentist? I have 3 kids, 2 older girls and Stella is
Yeah.
5. They go twice a year to the dental hygiene.
The
I live
dental,
in
yeah.
Switzerland,
Uh-huh.
We're from Europe.
Okay,
So special needs dentist, non-existing.
okay. So,
Non-existing.
not-
So I've looked for everywhere, it's non-existing. So I'm taking Stella to the visits with her sister.
yes,
So she can already get used to the smell and the thing.
Beautiful.
And she's a very nice Canadian lady.
mm-hmm,
And she did look, she would lie on me, I would have the iPad, and she would look in her mouth, and then she saw that she has some things to clean.
yeah,
You know what
yeah,
it's
yeah, yeah,
called?
yeah. The tartar down here, uh-huh, mm-hmm,
But then she said, it's so little, I don't want to be invasive now and
okay.
do more harm than I think will do good.
Okay, so it's the comfort level of the operator, having a hygienist or a dentist or whatever level degree is met. It's I was going to call it a plain operator. It is a comfort level operator. So maybe if there is tartar down there, the longer you keep, the more it's not. You can't get it off at home. Once it comes out like cement, that yellowy stuff, you can't get it off at home. The longer it's there, the longer it's going to cause inflammation, the harder it's going to be to get off. So if possible, if there's anywhere locally that you can, to see if there's anyone, the trauma to her, it's not.
It's more of the trauma that she will just close her mouth. I mean, she bites like a bulldog.
Yeah.
She does
They're-
not let go.
Yeah, no, I know. I've been on the other end of that
I
before.
can block
Yeah,
the
yes.
and I
It's
do all that stuff, but just the idea of a hook going
Yeah.
in, and I see the fishy thing like this.
yeah, I know, but it can be done. There are also they could on the brush that spins with like usually the paste. There's a tip that's the green stone. So the operator's fingers are farther away, and it spins and it can also help. It's not as thorough, but it can also help to flick that off.
Okay.
I'm pretty sure Annabelle's bitten you quite a few times.
Yeah, it's kind of like part of the job. Yeah.
Kind of along the same lines. I mean, I can't find a special needs dentist.
You
I
can't.
no.
So the pediatric, have you looked to see at the American Academy of Pediatric Dentistry, AAPD? If you go on their website, all of those dentists have had 2 years out, at least 2 to 3, depending if they got a master's, outside of dental school. Every program should be trained in special needs.
Because we have gotten a cleaning, and I was asked if she bit, and they kind of rushed us out. And I had called ahead to say she's special needs, and they kind of don't think they really understood that. They said, okay, we'll give you longer time for your appointment. So, well, that's not going to be the only thing that you need to do. Right. But so then they kind of shoved us out, and I was like, well, I need to ask about X-rays because I'm worried about that. And they're like, well, sometimes we just never get them, and that's okay. And I was like,
Okay, so they're not getting them, and that's okay. And it might not be able to tolerate them. I mean, that's when the sedation would come in.
okay, so that's the next step.
I mean, so if there is somebody in your area that can sedate your child, I'll be honest with you. Sometimes, there are certain points where you might want to look to sedate. I would sedate when the adult molars are in, which typically happens. I mean, there could be delayed development, but up 6 years. So you might want to look for those first molars. If you wait until you see a hole in a baby tooth, that already is in the nerve, I'll tell you that right now. It already needs what's called a modified root canal or phlebotomy and probably a cap or a crown on the tooth. So it's better to be ahead of it. So if you're maybe if they're between 6 or between 5 and 7, they can do a sedation. And then I'd probably do about every 5 years after that, if you can't get your child to be acclimated to become in the dental office. But so there should be pediatric dentists that sedate children.
Do you do that?
I have an anesthesiologist come to my office and I treat children when they are asleep.
Okay, so a specific anesthesiologist, deal with levels of
Different level.
seizures?
Right. So these are things that you might want to have one that has an MD. Like there's dental anesthesiologists, which there is one that I work with that deals, especially he had a surgery center that only mainly dealt with like seizures and special needs, so I'm comfortable with a dental anesthesiologist. But so there's two ways, and you just need to ask them these questions: the dental anesthesiologist or an MD anesthesiologist. I would not 110%. And a lot of times at your local children's hospital, if there is if there's a dental school or a residency in that area, they usually team up with the residents. And that would be done in the hospital setting. That probably would be the best, so they can control the medical facility. I would never do it in a dental office with like an oral sedation or just IV. You need their airway protected. You need to have them intubated, 100%. 100%.
We started sedation dentistry when Marina was 8.
Yeah.
But every 3 or 4 years.
Yeah, it's just like that's just their maintenance. Like
Every 3 years, and we coordinate with the physician to do blood draw.
right, and all of that. The other day I had a no. The other day we had in the office the parents that was autism. So cut their hair, did their nail. No, I swear, I was like totally, of course. Oh my gosh, yeah. No. So it's that creating that team.
Yeah, we went to Children's Hospital.
Yeah. So the children's hospital is going to be the usually they have a lot of, there's about 150, 200 residencies. So see if we can get one that has a dental department. And then those dentists are trained. So if there's any residencies, any pediatric training, because but they might need to sedate. That is completely legitimate thing. And then you do it on a kind of that little bit of a routine basis, like 3, 5, whatever, depending on the level of care they need, how much they build up their, your
It takes
your
about
things.
3 months to coordinate all the different
Yeah, it
things
does.
you're
It
gonna
does.
do. Just go in, do it.
It does.
Where are you from?
Portland, Oregon.
Okay.
Yeah. So Seattle has a great children's. They have
Yeah.
a great residency. Yeah.
They do.
Yes.
And they have liaisons that kind of organize all that stuff.
Yes, through the hospital they do. Because I trained at Children's Boston. I know that they, this is where a lot of this started. And that, we were like all over with all the different teams. But I'm trying to now say in the private sector. Yeah. Yes.
I think they're good. Well, with our son, he's 10, and for some reason that is instilling in me, what's it going to look like at 15? And am I going to rely on him and the dentist? Relatively no, because even now at 10, he's hard.
Right.
But I know that with routine and consistency, it really helps. So he is fabulous at getting his hair cut because we're going to the same guy for 6
Right.
weeks, and he sits in the chair now, and I don't have to hold him, and he's fabulous.
Right.
So I've now decided to do this with the dentist.
It's that. Thank you. Because that is what it is. It is and unfortunately, I tell parents all the time, it has to be on your OT like this. This is that's what I wrote in there. Life skill, haircuts, dental visit. Life skills.
Unfortunately, insurance doesn't necessarily.
No, and depending on, so we, at my office, I can only speak from what I do. Like, I usually charge $20
Yeah.
for these play dates. Because then you have a little bit of time. But it is consistency. So these are things what you would ask for. A time of day. You do not come to my office at between 3:30 and 6 with your special needs kid. That is, I have a balance in my practice. I'm not all special needs. I wish when my kids are all through college and I can do this at a level where, that I will devote my practices. Meanwhile, I have to live. So because of that, I can't see them in the middle of the day because that's when I see my, typical kids and I do all my stuff. But in the morning when it's quieter, because in pediatrics, parents don't like to take their kids out of school for a cleaning, unless, in the normal realm, in the typical realm. So what they do is that's where it's a lot quieter. So I have my assistants have their they have their kids, like Karen's Liam and Annabelle, we have I know she's bonded with Jackie, and there are people you need to make sure that they have, or they could be a hygienist, but you need to make sure that they have the support staff in the front and the back. Makes the question to ask, are they there that day? And also, if the quietest time in the day and the best time for your kid, if you know that they, the witching hour is 1, 3, noon, 10, I don't know, every child's different, and I know every day is different, but if you have some kind of thing, I would definitely try to make the appointment where those two match up. The best time of day for the office and the best time of day for your child. The next thing is to make sure that you can be with your child the entire time. A lot of pieces are like, parents are out the waiting room. That's not going to work for you. You need to have that support. And you need to be able to bring everything that you're with. If you have aid that helps you, or
iPad, whatever.
a pad, a stuffed animal, a weight blanket, like whatever it is, you need to be able to bring that with you so you can kind of create the environment. The next thing, like what you had mentioned, is that there's nothing, like I said, anything special about the dental, the bathroom at home, excuse me. That chair is not magical. It is convenient for me, but it is not magical. And a lot of times that's a block. They don't want to go in that chair. So in my office, like I have the chair for the parent, like a regular chair, and I have the dental chair, right? So a lot of times, like I will do things when the child is in that chair because that's where they want to be, or like we have a bench or whatever on the floor. I mean, I had a kid who, like, you know, autistic spectrum, like they were not having their teeth cleaned. Okay, so we played on the floor, then I sat there with them on the floor, and that's why I wear tennis shoes and pants, and you know, and then eventually, like, you know, Jackie brought me the mirror, and I quickly got to do the mirror, and you kind of sneak it in. So you need to ask the questions like, do they have different techniques? Can I just come to the office before and look around? Can I take a mask in my office is not a deal breaker. Gloves are, because that's gross, but mask is okay. So, you know, can I take a mask home? I mean, I'm sorry, if you want to try play with a mask. Some kids like it, some don't. Can I take some gloves home? You probably have gloves anyway, but maybe if some offices have different colored gloves, maybe they want that. Can I take a mouth mirror home? That is a cheap, safe item for me I give them out to parents if they need it. The mouth mirror, or you can probably buy one online. Oh, yes.
Me and Annabelle in our masks at our last dental visit.
Right, and you guys, and they got comfortable beforehand. Yep. So you can ask them, I mean, that the pointy instruments, no, but the mouth mirror, the suction, just that, obviously not attached to a suction, but even like taking that home to ask them if you can take some gauze, the disposable things that you take and throw away. You know, if it's an office that truly treats kids with special needs, they will be more than happy to give those things to you, I would imagine.
Yeah, and don't be afraid to ask. I know we all kind of, I mean, you know, we all know that it's our job to be advocates for our parents, but I think at places like the dentist, it can be so overwhelming that we kind of forget that we can really, like, the power is with us to really cater the experience to our kid, and the dentists will work with us. And if they don't, find someone else if you can. Dr. Jill and Dr. Michael are, I think, our fourth dentist that we've seen in the LA area, so, and we're good.
Okay, and then the familiarity, right? So, I mean, most places now have websites, right? And a lot of times they have like a picture of the dentist somewhere on the website. So you're gonna ask, who are they gonna see? I would not start with a hygienist. I would, no. It needs to be the doctor. It needs to be the dentist, for sure. So there should be a picture of the dentist in there, so your child can be familiar with their face. Also, if there's pictures of the office, for some reason, people think that the dentist has to look like Disneyland. It is so not my philosophy. It is so much stimulation. Oh my goodness! You walk into some of these places, and there's my dental conventions, like the shows. We can build a whole jungle world and under the sea, and oh my gosh, the colors and the lights. I mean, I like have a panic attack when I walk in. So if you already like predisposed to anxieties, and then you're like, what are they hiding here? Like we go to these places when after something bad happened, or I'm just like no. So you need to try to find someplace, if possible, that gels with your child, if that's an issue. So ours looks like a home, because you want to build like you're just going to mommy's friend's house that happens to clean teeth. So that is, I know it is a rarity, but it's starting to trend more like that. So if all you have is areas that have a lot of, like Disneyland theme-ish kind of stuff, then you want to maybe ask if you can come and just have a day when you're only going to walk in the waiting room and then walk down the hall, and ask them if you can do that and if they're willing to have those little short play date appointments. And then set one thing that, as an advocate for your child, is to set goals. Like I will tell a parent, today our goal is to get them in the room. Yeah. We're good. We held the mirror. I got to 5. We're good. That's the end. Like short, happy. Like try to end. Not everything's happy, but end on a positive note. A note where it's something that they can accomplish, because that's for everybody's mental health, including the dentist. I'll tell you. At least I'm the dentist. Like I like to always end that way. Yes.
Yeah. My daughter rated a special needs dentist, and then she had a hernia operation and getting in the chair again.
Yeah.
She's 28. She has no filling. She's just had her wisdom teeth and rollers out. But we have to papoose her now, and it's getting harder and harder to find people with papoose.
Yeah.
Is that in the dentistry, is that against the rules?
No, I don't have a papoose port in my office. It's hard, it's a philosophy thing. And dentistry, it's very regional. It's very, very regional. Like, if you're in the middle of the country, they do oral sedation constantly. Like, that's what all the training is, to do a lot of oral sedation. Cincinnati is a phenomenal program, and they oral sedate everybody. In Boston, don't oral sedate at all. So, I mean, and that's where I was trained. So, it's regional. So, when they do a lot of oral sedation, they papoose you because you wake up in the middle. So then you have to have that physical restraint.
With me, I just don't want to put her under
Yes,
when she has nothing wrong with her teeth.
right.
So the papoose is like a routine.
Yeah. So then that works for you, right? Because I have, a few, like one girl I'm thinking of is 26. She'll pop up. She'll do things, and then I just we just kind of bring Megan back. We just kind of bring her down. But that, I don't, it's a style. Is it out of vogue? No, I think it's just regional. I think the answer. Yeah, and they do have adult-sized papoose boards. They do.
Yeah, well, we use one, but
Yeah.
there's only one hospital that we could find. Everybody else wanted to stay there.
When just go right, because I'll be honest with you, it's the easiest thing to do is when they're sedated. Yeah,
And
yeah.
then we had to pay for it the
Right.
first time out of pocket, which is not very much.
Yeah, no, it's very costly. So I would, but pediatric dentists should still see.
Yeah, she's 28, so they're kind of.
They have moved on. Yeah. There is a subset of like geriatrics, which I know she's like, but they might be able to accommodate to have that. It's just that mindset of people who want to care for somebody like that. That's all. It's the mindset. So you might want to look into those dentists as well. Yes.
Our son does not indicate pain.
Mm-hmm.
Even when we ask, even when he's crying, he walks around, not all the time, but frequently. He's done this for years with his hand and his jaw and like this. I think it's a stem, but is with him going in, with you going in, seeing his mouth, would there be pain if you don't see anything?
So if with a clinical exam only, just with my eyes, not with any x-rays, and if you got clearance, if nothing looks wrong, how old is,
He's 7.
was there a period of, because right now he's in the middle of teething again. So when did it start?
No, right now, I don't think he's doing it.
Okay.
But
It could be eruption pain again.
Honestly, he has not been to the dentist yet.
Okay.
I've been,
So if he got cleared from an exam, and I know to get x-rays it might take a long time, so that's my next way, but the blessing is primary teeth don't usually cause pain as much as an adult toothache. So that is one, unless there's like a nerve problem, like I had about the nerve inside going crazy, but it was an adult tooth. But like if it's a back molar cavity that you'd only be able to see in between your teeth, a lot of times they do not cause pain unless there is like a facial swelling. Or those times you can see a hole in their tooth. So when it's at the point where it's just a cavity that doesn't see a hole with your eyes, they rarely cause pain. So it could actually be, because do you remember how old he was when he got his first tooth about?
it was about 6.
6.
He lost like 3 in about a month and a half. 2 of them he swallowed.
Okay, yeah, so he's in the middle, right? So in this, from like around 6 to 8, typically, you lose 4 teeth on the bottom, 4 teeth on top, and you get 4 molars. There's a lot of action going on. So that could be some of the discomfort. That definitely could be. If you don't see holes with your, don't really see anything with your eyes, and if you don't see like a canker sore or an abscess ulcer, and that would last a shorter amount of time. But if it's been consistent, it could be eruption pain, for sure.
We always believed we could tell when Marina was teething as opposed to other pain,
Mhm.
or drool would increase.
Would increase, yeah. That also, that is a good sign at any age, even the adult, when you're changing to adult teeth. You can change to adult teeth. Yes. Okay, 10 minutes. So, I just want to kind of about the play dates, decor in the office, sunglasses, right, help, iPads help, your iPad, not just even if they have a TV, if they say they have a TV in the room, you don't know what's going, your kid could not care about what it is. I would bring anything specific for your child. Sensory overload, right. I think, age. So my academy says a year is when you come for the first visit. It's really for the parent. So if the bottom line is if they're forced, haven't been, I would put that on your long to-do list of things to try to find somebody that will work. But I would start going to the academy, American Academy of Pediatric Dentistry, looking on the list there that are listed. If you don't have any kind of children's hospital residency, but the hospital is going to be a lot more of a clinic setting. Obviously, if you can get a private dentist, and then that might have privileges at the hospital, because that if when you have to go that route. But to get those short play dates, the thing with residency programs is that every 2 years the dentist changes, 2 to 3 years, right? Because they leave. So that's one thing if you can establish. But they might have a recommendation that somebody that graduated that's in a local area that's close to relatively close, that could be also another connection. But most of the people that went to a residency program are members of the AAPD, for sure. Then the importance of the baby teeth is because besides just infection and making sure pain, is that they help guide in the adult teeth. So you want to be able to make sure that as your kids get older, that they can have the best kind of bite and function as much as possible. Okay. Yes.
That's I think my question. Our daughter chews a lot on things, and I can tell she's 5. I can tell her front teeth, I think, are
all
starting
worn.
to jut out.
Oh, okay.
Or just it's not looking totally right to me.
Okay.
I think they're shifting a little bit because of all of her chewing and sucking on her blanket.
Yeah.
Does that mean when she loses those teeth that will screw up her bite or whatever?
Okay. Right. So if you have an active force of pulling it as the adult teeth come in, yeah, they can. The answer is yes. They can move. Yes, they 100% can move. But yeah. So just my thing is to make sure what she's chewing on is safe. I'll be honest with you. Make sure that the plastic is BPA free. Make sure that there's no water inside any, any jelly kind of stuff. That's yeah. But the short answer is yes.
So that brings me to a question that I had that I didn't want to bring up till the very end, was orthodontics.
Yes.
You've ever sent, especially these kids, to orthodontics?
Yes, I have. We have.
And the reason I ask is, my daughter has so many things wrong with them. She looks perfect. She's, teeth are important to me, and I just don't want to have that added on to the stairs.
Right. No, 100%. 100%. So yes. So again, it's all a matter of if your child maybe can't tolerate that 2-hour visit to get the braces on, we have actually there's an orthodontist that is sedated and put the braces on, because we know they could deal with the wire changes. So these are things that our goals set for. Orthodontics has been changing tremendously. So now instead of having that goop, we had to take the impressions, there is an electronic where they just put a wand and they puff, 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 and they have a whole 3D model. Now with Invisalign has gotten so much better that maybe we can just, if they can tolerate keeping the trays in, because that's removable, right, where the wires are, these are just I'm just telling you the different options. There's a lot of options, and orthodontics is really expanding. So maybe, at some point, the short answer is it's not out of the realm of possibility, for sure. Because you don't have to be able to tolerate all those things. Because if they can keep the trays, if your child's okay with the trays, then they can do tray changes, and you don't need to have that goop in your mouth. So, yeah.
Well, our dentist, we talked to him about it, and he said, I can barely, brush her teeth when she comes to visit, so no way for braces, get that out of your head. Which, I have trouble with that, because I think there's a possibility, because there's so much out there.
There's so much out there.
How can we find an orthodontist who
How old is your child?
She's almost 14, she'll be 14 next month,
so the thing is,
or should we get it out of our head?
Question. Okay. You can do orthodontics in adulthood. So she might have it with her peers at 14. No, that might not be when she's
Okay.
ready. But can you have it at 20? Yeah. Can you have it at 30? Yeah.
I guess the question that goes along with that is I've heard the retainers are a problem, the dental office that you go in and replace the wires, or I don't know what they do.
Right. The white, right.
Bands or whatever,
Yeah.
all that seems to be a problem with the other kids that I've read.
Well, that's what I'm saying is that as advancements in dentistry, right? So having those little retainers, or maybe, so it depends on what the issue is. Maybe you know that you're not going to get a perfect, like they're going to present it at a conference how great the bite is, but maybe your thing is that if something is a little, they're all over the place. I've had kids where they're so crowded, we just end up deciding to take an adult tooth out and let them fall in, and that will help
did
it
that.
tremendously. You did that, okay?
Yeah.
Adult teeth or baby teeth?
Oh.
There were 2 adult teeth, I believe.
Did that help any of the crowding at all?
He said it did.
But you guys don't
Visually,
see it.
No.
It helped the crowd, but they're still
Yeah.
real crooked.
They're still really crooked.
Yeah.
I mean, it all depends, again, it's a
Yeah,
complication of the
Okay.
bite, it's a
How do we
complication.
find a good orthodontist in our area that would do that?
It's a kind of asking the same
That would be
questions.
on
Do
the-
you even, I would just, there's a orthodontic academy is the AAO, American
AAO.
Academy of Orthodontics.
Okay.
So again, look them up, or your dentist, does he work with does he or she work with anybody? Again, the residency, I mean, at the hospitals, see where there's an orthodontic residency. I worked craniofacial with orthodontics, and we put braces on kids with all kinds of stuff going on, and all kind of medical conditions. Yes?
Yeah, our orthodontist refused to do it because he thought the wires might fall off if she was under sedation. I mean, we were able to crank that pallet.
Yeah, so you did the palate span, and that was glued in a fixed appliance. Yeah, so you had that.
Like the Invisaligns work better?
They can't. In Invisalign, they've made great advancements. So my point is, I just stay on top of it. Ask the questions, because that might be a better route. It's that little plastic thing, but if they don't take it out and chew it, and they let it, can accept it, and they can try that without making a big investment in Invisalign. If they can do the models, if they have electronic one, or if your child can handle the goop, then the office can make one that is modeled just to their teeth now. It's very inexpensive to make those it's called a suck down retainer or suck down. Then if they see if your child can even keep the suck down in their mouth. You know what I mean? That way, you're not committing to, getting a whole treatment plan and a whole thing of orthodontics. So
How well?
it's bleaching trays. It's like, have you ever have your teeth bleach? It's just like little bleaching trays. It's bigger.
They don't stick though.
They don't stick. They have to be able to keep it in their mouth. I mean, do they fall out of their mouth? No, you have to kind of take them out.
Okay.
Yeah. But I mean, so you'd ask what a suck down retainer would be like, if they could. That's a good way to see if they can even tolerate it. That's just something that's in the horizon. I can't promise, but yeah, but any kind of force, thumb, finger, pacifier, biting, chewing, yeah, they're gonna move teeth. Tongue thrust, a tongue that sticks that out, it's gonna move your teeth. So, yes, yes.
How many times is optimal to see the dentist in the year?
Typically, it's recommended to come twice a year. Okay, but if you're working on a goal, then I usually sometimes see them every 2 weeks, sometimes see them every month.
Just for getting them in the room.
Those,
getting
play
them
date, yeah,
comfortable.
but yeah,
Like
that-
we've done that with Annabelle.
Yeah, to acclimate them.
Yes.
Yeah, I do mine depending on where we start, every 2 weeks to every month.
Yeah, and now I think we're at every 3 months?
Every 3 months now, yeah, because, and also depends on what if you have a lot of tartar, if I can get click off one tooth that visit, then we're good. Because because they hit a wall. Everybody hits a wall. It's just that, they're more it's more really hit a wall. We're able to say, okay, I can get through 10 more minutes, but yes.
So I would say insurance would cover 2 cleanings a year or whatever. That sounds expensive to bring them in every 3
Okay,
months,
so,
every-
yes.
Every couple of weeks, whether you actually sit there with them.
Yeah, right. So that's why I said that in my office, I charge $20. Or if you have dental insurance, what I typically do, which is, I'm saying this on recording, but, so you get exam, okay, exam is one code, cleaning is one code, fluoride's one code. Typically, insurances will pay for those 3 things twice a year, so that's 6 things. So I will charge exam, 1 visit, cleaning, 1 visit, that's 6 visits right there.
I worked for a dental insurance company for 16 years.
Oh, yeah. And then I'm gonna get my license taken away, yeah.
They're gonna look at you pretty seriously for that, but I don't know.
Well, sometimes I only can because you do exam, then one time you can do a cleaning. And then I won't do the fluoride unless I really put fluoride in my mouth. Because I every time I'm like touching a tooth, I'm cleaning something. Yeah, but I'll break up the visits.
That's interesting.
Yeah.
Don't report her.
I wouldn't never report it.
No. But I mean, I don't too. Yeah. No, but I mean, that's how, but they haven't got kicked out to have a cleaning, exam only than a cleaning, because you're right. Exam, and then there's a behavior modification code, and some insurance will cover behavior modification. There is a code for that. That's what it's called. Yeah.
Yeah,
And some insurance will, and some, yes, behavior
that's
modification.
key. Yeah,
Right, but if
that's-
she's coming less, and I'm actually be able to do like more things, and I'll bill out those things, but I only bill out fluoride if I actually use fluoride. Right, yeah, because I'm not gonna, because that's an actual thing that you do. But sometimes you do exam, and then sometimes you like pick a tooth. Yeah. So, there you go. Yes.
What I was saying was, our daughter was going in for a surgery, and so we lined all the doctors up.
Mhm.
And the dentist actually went in and created the space between her baby teeth, because she's 5. And it made brushing her teeth, cleaning so much easier, because there's that little space to where she'll grab her toothbrush and she thinks it's playtime. But because the teeth aren't packed together.
Yes, you can do a little bit of it. It's called, when you take the in between, you have enamel. So if you take some of the enamel away, you're not going to become sensitive. So they probably just shave the enamel away. I mean, I don't see the treatment plan, but they shave the enamel away on the baby teeth, make them a little narrower. Right? A lot of times, if kids will have cavities in the 2 front teeth, like right here when they're really close, I'll take a disc and they kind of make a space, so then it's like things flow better. So yeah. But it is coordinated. I've come in for other appointments, like we just talked about, if you have a dental sedation, cut their hair, do their nails, pick their boogers or whatever, right? I mean, so I will come in, and we've done things where they're under for something else, or we did blood draws. Another patient too did a bunch of blood draws for their today for dental. Yeah, just one last time.
I think we're out of time.
Okay.
But thank you.
I
so
hope that was
much.
informative, and again, thank you so much for. I'm honored to be able to give you any little pearl.